Okay, great. Thank you very much. So I'm a social scientist and I'm a sociologist of health working at the University of Oxford. And I've been working on topics that cross health and society. So more recently, this has been about vaccination attitudes. And that's what I'm going to speak about. I'm really pleased to be here today. We've had some really excellent talks. And for me, it's very useful to hear from that public health side because I would normally be around academics. So I think I've got a lot from today already. So thanks very much for that. Okay, so to give an overview of what I'd like to cover. So these are really to give some topics that will prompt discussion, and I'm going to give a bit of a background about reasons for low vaccine coverage, but including the access and attitudes angles to that. And because of recent developments, I'll talk about mainstream media portrayal about vaccination attitudes, social media and online influence, and how that's been having an effect, and also pushback. So what is going on in the pushback against opposition to vaccination. Okay, so you've had a bit of a hint of this so far. A lot of the time, the reasons for low vaccine coverage is split into these two camps, access and attitudes. And we've heard quite a bit about access throughout the day, and I'm going to concentrate more on the attitudes. But I don't think these should be viewed separately, and that's something that I hope will come through the talk, that these are part and parcel of the same thing, and go beyond that neat division. So I'm bringing up a map of the world and starting off with an overview of vaccine attitudes. So the London School of Hygiene and Tropical Medicine, they do a project called the Vaccine Confidence Project, and that looks at attitudes on a global scale across countries, tracking worldwide skepticism of vaccination. So they've been asking respondents whether they agree that vaccination is safe, effective and important, and also whether they think it's compatible with religious beliefs. These figures are for 2015, there's not yet 2019 figures. What came out of this survey is the high level of skepticism in Europe, particularly France standing out there. But also, beyond that country scale, what's not captured in this particular survey is particular socio-economic groups and also communities within that. And that's something that gets lost and can be supplemented by country surveys. Okay, so the London School, they make their data freely available, so something that I've been working on with another project in Oxford is Our World in Data that visualises long-term historical development trends. And you can see here what happens when you start comparing the perception of vaccine safety for DTP and actual coverage. And there isn't the kind of maybe correlation that you'd expect except for the Ukraine, which is standing out there. And we've talked today about there being a multiplicity of issues, and I think it's not clear that skepticism automatically leads to low coverage. It's one aspect of many. And you can see here that in terms of safety and low coverage, it's only really the Ukraine where there's a strong correlation. Okay, so I'm deliberately giving you a really huge table here with lots of underlying factors to consider for attitudes to vaccination. I've included access in here because I think that's part of attitudes. So we know from the WHO SAGE working group on vaccine hesitancy that the 3 C's are emphasised for reasons for not vaccinating, so complacency, confidence, and convenience. So to expand on this, I've included access, beliefs, values, emotions, explanations, and rights. So some of the problems with access we've spoken about today: supply problems, problems with price, and then more kind of mundane practical issues like difficulty making appointments, inconvenience and unpleasantness of the actual procedure, getting the right support and information from health professionals. And I think that's not always something that's considered under access. And I think for me, beliefs falls into two areas in terms of trust and confidence in government, pharma companies, scientists and experts, and also whether you might trust your own communities and those leaders more than outsiders. Undervalue some of the trends that we've been seeing in values that might compete with the road to vaccinate our lifestyle ones, so alternative medicine and pseudoscience, maybe alternative education, natural and green movements, and so on. And I should say it's not, I don't want to pick out these groups as being completely all opposing vaccination, but within those groups you do see that trend. On the emotional side, one of the strong emotions is fear. So fear of the safety of vaccines, the fear of the side effects, fear of an overload of vaccines. And under that emotional box, you can also think about apathy and complacency. So maybe not having the emotional response that vaccines provide, not seeing a threat, and so on. One other area is wanting to seek an explanation for something that might not seem very explainable. So what is complex or unexplainable is conditions like autism and autoimmune diseases, and then the idea that if you believe in one conspiracy theory, you're more likely to believe in others. So what conspiracy theories do is they offer this stability in quite an unstable world. Another area that we don't often get to discuss is the competition with rights. So rights to individual liberty and freedom, they might come into opposition with collective ideals for vaccination. And also this rights view of parenting or medicine and having parental choice and having a personalised view of medicine. So I'm going to bring up actually the same picture that Stefan had shown by yeah, the caricaturist James Gilray. And we didn't collude on this actually, so there must be something about vaccine attitudes in this particular image. But so this etching is actually from 1802 by a British caricaturist, and it's at the time that the Dr. Edward Jenner developed the first vaccine for smallpox. And he's shown vaccinating people using a lancet with material derived from cowpox. So all of these people, they're having cows in various shapes and sizes erupt from their bodies. And this is really showing the idea that vaccination was quite hard to accept even 200 years ago. And the action is really showing the public unease at the time. But I think there are some themes that are relevant now. So if I'm just going to click on here, at the very top you see a golden cow kind of being worshipped in this gilded frame. And that's an idea that, well, do you value science or is that competing with some other views? Also, do you trust your doctor? So that's Edward Jenner looking very disinterested there, and that's an ongoing issue. Right, so the people in the door coming through, they've been given an opening mixture. So there's a question of government coercion, especially if you're mandating that if you don't vaccinate it, you'll be breaking the law or you won't have access to services. And finally, there's this emotional level that Stefan actually talked about. So there's that fear of having a bodily interference and side effects and safety. Okay, so even though this is really quite a different context, we're aware of some of the things that are going on still today. And to make a note about the historical context, it was a time where the state was really encroaching on the private realm, and that was unprecedented. And there was a reaction to compulsion for one vaccination, smallpox. Working class people, they felt particularly persecuted. And there was a different level of safety and side effects and regulation to what we see now. But in terms of some of the underlying themes you see at work, there are some similarities. So the point that I want to make here is that vaccine attitudes are not strictly about the vaccine. We're talking about a mass health intervention from the state towards whole populations, so a whole range of concerns, issues and discussions, they also get sucked in. But that's why it's important to take into account the context and trying to understand that better. But what we should also note, it is a social norm at the moment to vaccinate. For example, in the US, only 2% of parents actually opt out of vaccination completely. But anti-vaccine views can have a big influence in driving anxiety and fear on vaccination on a wider level. That's what I'm going to go into next. Media portrayal. So moving on to this next point, we've seen the media can amplify the idea that there is opposition to vaccination. But terms like the introduction of the term vaccine hesitancy to capture those fence sitters also makes us think about other groups in society that are affected by vaccine views. And in general, the mainstream media is supportive of vaccination on many fronts. Many outlets, they no longer provide this false balance where you have to have on one side of the debate someone promoting vaccination, probably from a public health background, and on the other side someone who's opposed and anti-vaxxer. But there is also this pressure in journalism to sell a story. So the anti-vaxxer story does make it to the top of headlines. And then something I want to touch on before I end is the social media and online influence, and as a subsection of the media. So social media and online platforms, they become a really big discussion, especially in the last year. And you can see here, there's been a lot of activity, especially following a letter by Adam Schiff, who's the chair of the House Intelligence Committee and a Democratic representative. And he sent a letter to Google and Facebook asking them to take action on vaccine misinformation. And you can see the response of various platforms and companies to that call. Pinterest, which allows you to upload images from the web and put up pinboards, and they're not allowing any vaccine-related searches. YouTube, they've blocked anti-vaccine channels and videos from monetizing. Amazon, they've also removed films and documentaries that they deem as being anti-vaccine. Instagram has blocked hashtags that they say is verifiably false information about vaccination, although if you do a search on this, I don't think it's having too much of an effect. Facebook, they've been saying that they're making anti-vaccine ads and groups less visible in feeds and tweaking recommendations. And same with Twitter with their search tool. But those two companies, they find it harder because there is this conflict with allowing free speech, so they haven't been able to take the same measures that you see with that very direct response with, say, Pinterest. Okay, so I can see a bit of a problem with this concentration on misinformation, because I think it is reverting back to an old model saying that people just need to be re-educated. And if you remove that false information, then they're going to change their attitudes and behaviour, but this might not be the case. I'm not saying it's not a problem, but it needs to be viewed in a larger context. Just to say also, because this is a bit of a bugbear of mine, low and middle income countries also have attitudes to vaccination and problems with vaccine acceptance. And we've seen that historically, and it's not always connected with ignorance or irrationality, but political context and a mix between access and attitudes. And finally, pushback. So what are the pro-vaxxers doing? And I think this is also an area that doesn't get discussed very often. There are advocacy groups who are looking to make change in society and in policy and law and with the media and online communities that are promoting vaccination, and these groups need to be supported. So thank you very much.